Hello. Oh, hopefully this isn't too dark. Hi, there I am. New glasses. What y'all think? So I'm gonna be, like I said, my channel is gonna be about different subjects and topics and just kind of whatever I want to speak of. And I know that conservatives and Republicans are always coming out against quote unquote Obamacare, otherwise known as ACA, the Affordable Care Act, which actually has benefited many people. I actually benefited from the expansion of Medicaid last year when I was very sick and unemployed, and I did not have insurance. I was able to get Medicaid through the state that I live in. And I was able to have surgery and go to the doctor because and to the emergency room because unexpectedly I had very serious issues, including ovarian cysts and other serious issues. They thought I had cancer. And then I had to have a complete hysterectomy. All of that was covered, thankfully. Otherwise, I don't know what I would do. I would be under a mountain of debt. So I'm very thankful for the expansion of Medicaid, and I'm sure other people are too. And I actually work in the healthcare industry. I work for a insurance company where I live, and which I love my job, love it. But I was perusing online through some pharmacy and medical websites earlier today, and I found this article from modernmedicine.com. It's an article dated April 7th, 2015 by Tracy Walker. I want to make sure I put all this in here so I don't get accused of saying this is my words, which they're not. The title is Study Finds Earlier Diabetes Diagnosis in Medicaid Expansion States. Okay, I'm not going to quote the entire article, but I'm just going to kind of hit some key points here. People in states that expanded Medicaid under the Affordable Care Act are far more likely to be newly identified with diabetes than in states that elected not to expand, according to a study published online in Diabetes Care. Newly identified diabetes in Medicaid patients surged 23.2% in Medicaid expansion states, but increased less than 1% in states that chose not to expand. Patients with diabetes were diagnosed at earlier stages in states that expanded Medicaid. As a result of being diagnosed earlier, it is likely that outcomes from the disease can be improved. Here's a quote. The findings of the study indicate that Medicaid expansion states have had a positive impact on providing access to care for patients that previously may not have had access or more limited access, says study lead investigator Harvey W. Kaufman, MD, Senior Medical Director, Quest Diagnostics. Taking a preventative measure to curb costs from skyrocketing is a strategy that also, and more importantly, benefits the patient. Other key findings: older patients experience the highest rates of diabetes diagnosis in Medicaid expansion states. For those aged 50 to 64, the increase of newly identified cases were 31.2% in the expansion states compared to only 0.5% in the non-expansion states. And for younger patients aged 19 to 49, it was nearly 15% in the expansion states with no change in the non-expansion states. And diabetes is a disease that affects more than 29 million Americans. It is the 7th leading cause of death in the U.S. and a significant contributor to death. And it's very costly for patients and for providers and insurance companies and just everyone involved. It's a very costly disease. So the earlier you find it, get diagnosed, get proper treatment, and maybe even you can reverse if it's found early enough, by losing weight, eating healthier, And sometimes, yeah, you will have to be on medication for a while. But if you do the other things to improve your lifestyle, get moving, which I need to do, obviously, um, you can, even reverse the disease to an extent with type 2, not type 1. I want someone quoting saying type 1, type 2 diabetes, which, of course, has really, the rates have just, been phenomenal. I would say probably over the last 30, 40 years, the cases. So I just want to bring that to everyone's attention. Republicans are always putting down the ACA. They want to completely scrap it. And this shows, this is another positive aspect of it. So, thank you.